This presentation will cover the healthcare adaptations that occurred during the COVID-19 pandemic. We'll start off talking about the timeline of events that impacted Ohio specifically and the Dayton area hospitals and privately owned clinics. We'll hear from nursing students who quickly adapted and began checking in patients and doing so with the new protocols in place, and two local area physicians who privately own their own small businesses. On the timeline, you can see January 23rd was the first day that coronavirus was now being reported in hospitals as a disease itself. On March 9th, Governor DeWine declared it a state of emergency as we now had 3 positive cases in Ohio. Previously, some people might not have even known the governor's name, but as the timeline progresses, hashtag Wine with DeWine time would become a trend as everyone in Ohio would tune in to hear the latest announcements and new mask-wearing guidelines. On March 17th, it became a shutdown of medical offices as only emergent procedures and surgeries were being scheduled. Anything elective or annual appointments, they were now being delayed. Physicians in the area were wondering what this means for their own small businesses or future careers. Telehealth came in and expanded the ability to be able to contact your doctor from your home. And this lasted until May 1st when the offices reopened for their elective surgeries. And as you can see in the next session, you'll see how Kettering Hospital specifically responded by taking temperature checks and limiting the amount of visitors that they have coming in.
Here to visit or for an appointment?
So I'm visiting someone.
Visiting? Okay. Are you the only visitor for today?
Yes.
Okay. They're only doing a 1 visitor per 24-hour rule, so as long as you're the only one, we're good.
Yeah, I'm the only one.
All right. So we're just going to take your temperature behind your ear here. All right. 97.5.
We've been working at screening stations rather than on the floor. So as patients and family members come in, we are ensuring that they are following the different rules that are changing daily and sometimes even during the day. So that's been the hardest part for me, is telling people they can't come in and see people they love.
President Bill Clinton enacted HIPAA in 1996, and it's been our main way of enforcing privacy and confidentiality among physician and patients. During the COVID pandemic, though, the Office for Civil Rights allowed much more flexibility temporarily to allow for such quick telehealth changes.
And so the patients could send photos of their rashes or their lesions, and I could answer them by calling them and talking on the phone or doing videos, and it was suddenly covered. And to make it happen so fast, they took away all the HIPAA rules. HIPAA means that, we have to worry about confidentiality and it's going across the internet and all this. Suddenly we could just FaceTime a patient, and it was telemedicine. We could do our office calls and our visits, and it really helped carry us. I was able to do that a couple half days a week for patients who just needed refills or prescriptions, things we could handle on the phone. On the other hand, any procedure that I could do, I wasn't able to do on the phone, obviously. Some of the patients came in the parking lot and they didn't come inside, but I could take my cryosurgery out there and freeze places on their skin if they needed, or take stitches out. We would go to the parking lot and take care of them in the car.
Next, we'll take a look economically how the Dayton area clinics were able to survive the shutdown. The Paycheck Protection Program was announced by the government as a way to provide incentive for the small businesses to keep their staff employed and their office running, even though it would be working remotely. The way it worked was that this was a type of loan that you could apply to if you met certain criteria, such as office size and type of office. It would be fully forgiven by the government if you met the criteria of using 60% of the money gained towards payroll to keep your staff employed. You could also spend the money on interest towards mortgage, utilities, and rent to keep the businesses surviving during this time.
We saw maybe 5% of our normal volume through the last week or two of March and through the whole month of April. So rather than laying everyone off, I just kept all the employees at full time. Most of the time they were home, but none of the employees went on overtime or unemployment. And the government did provide payroll protection plan, or the PPP loan, so we got a loan from that allowed us to keep paying the employees and not put them on unemployment. So yeah, there'll be less revenue for the year, but as far as our staff and employees, all of them are still getting full pay.
To end on a positive note, there have been some positive changes that have come from the shutdowns. There's been a huge drop in pollution with people traveling less and working remotely, and NASA satellites have even seen a 30% drop in air pollution in the US. I also think that the telehealth access to more physicians has allowed them to learn new technologies, and patients have been able to get care that they might not have already been able to receive. Thank you so much for watching. Wear a mask and stay safe, Ohio.